Hello guys. Now today we are going to check into surgery. We are going to start on the introduction part of surgery and we shall eventually complete the entire unit of surgery. There are several topics included in the surgery, but surgery as a discipline is a just substandard, very typical and very compounding discipline, which actually is more of like a backbone of studying medicine. That is at most, that is why we always have medicine and surgery. Now today we're going to check on the very vital aspect. Now surgery as a unit, it's only not only being studied by clinical medicine students or MBCHB students, but even it is included in some portion of units in nursing, especially the one which is called medical surgical nursing. They have some bits of the surgery. Now commonly, or maybe in a lay way, any other time when you mention surgery, somebody will tend to think something to do with operation, cutting down, cutting inside, getting inside the body, doing this and doing that. But I want to just tell you, surgery is more than that, because during surgery, there are many other things that a medic or maybe physician supposed to be informed about. The patient you're performing operation onto, or maybe surgery to, must also be eliciting some preparation, or maybe let's say some typical physiological function which are actually okay with the surgery you're performing. So as a surgeon, you are expected to as well have knowledge about disease, medicine, and physiology, and even anatomy of a human being. So it's not all about knowing how to cut in and cut out, or maybe stitch. So today we're going to check on the unit of surgery, and the first thing that we're going to check on the topic one, that is introduction to surgery, definition, type of surgery, and surgical divisions. Now, today I want you to know that surgery is a medical specialty that uses operative, manual, and instrumental techniques on a patient to investigate and to treat a pathological condition, maybe a disease, injury, or it can also just help to improve. So you see, not necessarily that you need to do surgery during amputation. You don't need to do surgery to correct a fracture only. But sometimes we also do surgery to determine or diagnose any problem which is underlying, maybe in the pancreas, maybe in the gallbladder. Okay? So we need to get inside the body and get out. That is why when you talk about laparoscopy, when you talk about uh, abdominal excision, when you want to assess what we call aortic aneurysm, we have to get inside the abdomen and check inside. So it can be used as a diagnostic tool to investigate, can as well be used just like any other thing, like a corrective, like a medicinal, like that is to mean that when you want to correct a fracture, we'll be using surgery as well. So that is that. So when we talk about surgery, it can refer to many things. Just an act of performing a surgery, that is still surgical procedure. Operation, you can just say surgery. My brother went to a surgery. My brother went to surgical procedure. My brother was done to operation. So all that one is still the same. So to operate means to perform a surgery. Just that is that. And surgical means pertaining to surgery. Something surgical, something surgical. Oh, we have an RTD, or yeah, road transport accident, RTA. So that is the case. So in case of such, that boy had a fracture of, one third or tibia or ulna. So what do we do next? Is it an open fracture or a closed fracture? We'll do surgical procedure when it's an open structure, or maybe reducible closed fracture. So that is all that. But you can, to operate means performing surgery. Okay. So surgical means pertaining to surgery, anything surgery. So as a general rule, a procedure is considered a surgical if it involves cutting of a patient's tissue or closure of previously sustained wound. So, of course, surgery can be used to repair broken bones, control bleeding. We have aortic aneurysm which has ruptured. We get inside the abdomen, we compress, we apply pressure, we do some things to do with coagulation, we give medication, all that. We can also use surgery to remove injured or diseased tissues. We do debridement into non-healing wounds with dead tissues, okay? Some organs also are supposed to be exist. When we talk about appendectomy, okay? Appendectomy, appendicitis, the appendicitis. When you have appendicitis and the appendix has some terrible inflammation, we get inside the appendix region and then we remove it. If it is located in the abdomen or pelvic or peritoneal, we get inside there and we excise it. So that is removal, okay? So a surgeon now, who is a surgeon? Surgeon is just a doctor who do operation, cuts in tissues to treat diseases. So surgery itself is more of a craft and art. And that is, of course, I wanted just to confirm to you that a surgeon who does not routinely practice surgery or operation tend to forget. Just like any art, if you're an artist who draws, if you're a craft artist, if you don't practice your skill, that you tend to forget. Only some few motor skills, such as eating and walking, riding bicycle, you hardly forget unless you have a very strong accident which interfere with your brain, the part which revolve around the motor skills. So surgery is very, very hard and craft, and then it involves making judgment, coping under pressure, taking decision, action when necessary, and therefore any surgeon is supposed to be very, very able and qualitative. So let's see types of surgery. First of all, we have they are classified based on one timing, okay, based on purpose, okay. So we can have surgery or operation based on timing, and we can have surgery based on purpose. Talk about surgery based on timing, like elective surgery. You say that this patient in ward number 25, male ward number 25, bed 2, supposed to be done to elective surgery. What does that mean? Elective surgery is one of the type of surgery which is under timing. Elective surgery is done to correct an life-threatening condition. It is it is subject to the surgeon and surgical facility availability. So it is not emergency. It is just elective surgery. So we have to plan and do an elective surgery. It's done to correct an life-threatening, like a situation which is not that fatal. Okay. Then under the same we have emergency surgery. This surgery which must be done promptly to save life, maybe a limb or functional capacity. Like one of the group I realized, orthopedic groups, medical students, I don't know, somebody shared, I think that was the lower limb fracture, left leg. It actually revolved around fibula and tibula, the junction of the ankle junction, okay? And the fracture could be really visible. And in fact, that fracture is terrible in a way that if emergency surgery is not taken in consideration, we may run into some complication, okay? We can have necrotized fasciitis, we can have, okay, the blood supply can be cut off, and therefore we can end up having necrosis. The tissue will die. So if it is not handled, we'll end up amputating the limb, okay? The emergency perspective now comes in. So based on the timing, so elective surgery, say we do it to a non-life-threatening. Emergency surgery, surgery which must be done promptly to save life, limb, or functional capacity. What about based on purpose? Based on purpose, we can classify types of surgery as either explorative surgery, therapeutic surgery, or cosmetic surgery. Explorative surgery is performed to aid or confirm a diagnosis. Oh, this guy was diagnosed with cholecystitis, okay? Inflammation of the gallbladder. Now, because we just use clinical presentation, we know symptoms that are associated with cholecystitis, help us to rule out possible diagnosis and gotten into maybe cholecystitis as a maybe differential diagnosis. So for us to confirm, we get inside, we do laparoscopy, we check on the gallbladder to determine whether actually it is the case of the condition something. Okay, that is explorative. Talk about therapeutic surgery. Therapeutic surgery is to treat previously diagnosed condition. Of course, therapeutic surgery, we get inside your body, we cut, we get inside, and then we correct a problem. Despite the fact that we can correct by removing the part, it is still correcting. So it is still therapy. So like in appendicitis, we do appendectomy to just correct. When you have inflammation of the fallopian tube, okay, salpingitis, okay, we get in the uterus, in the pelvic region, or maybe abdominal pelvic region, we target the uterus, I mean the oviduct, and then we cut it out, we remove it, okay? So that is therapeutic surgery. Cosmetic surgery is this what female, the local female, the Africans, I mean, nowadays they want to look like the whites. They have been influenced. The world is changing so rapidly in a way that even our whole culture has already gone. As well, I would like to say that even not only the culture, even the moral, in a way that the melanin saturation that we had is nowadays a poison to our ladies. So in this sense, you find some people go for cosmetic surgery. People who are born with genetical variation, poor genes, that is to mean they never had good body framework in terms of the curvature, they end up correcting by doing cosmetic surgery. So it is done to improve the appearance of an otherwise normal structure. And classification of surgical condition, that is, I mean, type of surgery I've said based on timing and I've listed them. Now, based on purpose, I've also told you we have explorative surgery, therapeutic surgery, and cosmetic surgery. What about classification of surgical conditions now? That was class types of surgery. What about based on surgical condition? What about based on, I mean, surgical? How do we classify surgical condition? So we have things to do with emergency surgical condition still, urgent surgical condition still, elective surgical condition. Just the way I was telling you, still applies the same. Emergency surgical conditions, they're just unpredictable event that results in the need for immediate surgical attention, and they are termed as emergency surgeries, like injury from automobile accident, like a vehicle, a fire, a violent assault, somebody amekukimbiza na machete, maybe a sudden change in chronic medical problems such as perforated peptic ulcers or a strangulated hernia. Some still under emergency cases typically involve treatment of gunshot, stab wounds. Nowadays, ladies are being stabbed by their boyfriend for misbehaving. I don't know if it is true or false. Now, head injuries with intracranial hematoma and lateralizing signs. When you have severe eye injuries, like maybe umemwagikiwa na acid or something, maybe something which is hazardous, so maybe chemical to your eyes, the still severe injuries. Those are just emergency surgical conditions. Okay? Acute airway obstruction, you've been choked by your bony fish. Multiple injuries, multiple injury can be from assault as well, can be from an accident. Okay, acute abdomen, even multiple injuries can be bite from wild animal. If you go to the forest, do some hunting, and then any of these can be a hyena, lion, jump onto you and deal with you squarely. Now, acute abdomen presenting also can cause, if it's acute onset, severe pain in the abdominal area for which immediate surgery might be remedy, because acute abdomen can be because of many other things apart from pancreatitis, cholecystitis. Okay, it can be due to many things. Even aortic aneurysm can bring in acute abdomen. Okay, so it's still under emergency. Intestinal obstruction can still under be emergency surgery. Interception, testicular torsion, somebody has just kicked your testicle, you landed on a hard object, your testicle hard, or maybe the torsion is because of sexual activity, whatever. It can as well come because of that. So that is still under emergency. Okay, and then the second one I've said is urgent surgical conditions. And urgent surgical conditions are cases in which an operation is vital but can be postponed for a few days, e.g. injury with minor bone fracture, acute cholecystitis, acute diverticulitis, kidney stone, cancer of vital organs, all those ones. Okay. Injury with minor bone fracture is still urgent but not emergency. Acute cholecystitis, acute diverticulitis, still but not. Kidney stones, still somehow urgent but not emergency. Cancer or vital organs. Okay. Then we have elective surgical condition. Elective surgical condition can be required, selective, or optional. Just there. So it requires surgery cases including physical ailment, but they are serious enough to need a corrective surgery, but they cannot be scheduled for weeks or months. They can be scheduled for weeks or months in advance. They cannot, and it's not that urgent. It's just elective. So the hospital must be ready. The surgeon must be ready. So it's based on some formality. It's not just. It is not a must, but it has to be done. Okay. So yeah, still under elective surgical conditions, we can talk about selective surgery. Covers a broad range of conditions, and they are of no real life threat. The immediate physical health of the patient is not a threat. So, but nevertheless, they should be corrected. Okay. So, like a cleft lip and cleft palate. You remember these children were born with a split on their lips, or maybe on their palatine. Okay. Yeah, maybe even removal of certain cysts, benign, fatty, or fibrous tumors. Okay, and then they are just optional surgery, including operations that are primarily for cosmetic benefit. So even cosmetic benefit can be classified under elective surgical condition. But if it is removal of things like warts, other than non-malignant growth on the skin, still under elective. Okay, blemishes of the skin, plastic surgery, those are still elective. They are not emergency surgery. So in surgery, there are some terms that you really need to know. When I say ectomy, that is excision. Okay, yeah, ectomy. It is you get is like a prefix. So it just means to excise. That is, start with the name of the organ to be excised, and it ends in the ectomy. So, for example, you find if it is a removal or excision. Excision means removal. So, ectomy, if I want to remove a gallbladder, I'll say colectomy. Okay, from the name of the gallbladder, and then if it is stomach, I want to remove, I say gastrectomy. So, to excise, to remove, gastrectomy. Lumpectomy is if I want to remove a lump. Another one is otomy. These are just procedure involving cutting into an organ or tissue, and in otomy, most of them. So, like laparotomy, cutting through the abdominal wall to gain access into the abdominal cavity. Ostomy, it's just a procedure for formation of permanent or semi-permanent opening. Okay, like ostomy. So don't get confused and confused between otomy and ostomy. Otomy, you cut into an organ tissue. Ostomy, you just form a permanent or semi-permanent opening. So, for example, colostomy, we are into the colon, that is the large intestine, but just through a hole. Ileostomy, we are into the ileum using a hole. Then we have oplasty. Oplasty is reconstruction, just like cosmetics. So plastic or cosmetic surgery of the body, and with plastic. Okay. For example, rhinoplasty, when we repair the nose tissues around the nose and the yeah. Talk about when it ends with raphy. Anyone ending with raphy, it's repair of damage or congenital abdominal structure, like aneuraphy. Okay, that is hernia. We're now correcting it. Oscopy, it just involve invasive procedure involving small incision through which an endoscope, which is like a camera, is entered to now see what is inside there, like laparoscopy. We use something like an endoscope, and so that is laparoscopy. Okay, endoscopy, when you want to diagnose some ulcers, we use, or gastritis, use endoscopy. Okay, then amputation, surgical removal of a limb or body part. We still have some terms like fistula, just a tunnel connecting two epithelial surfaces. We talk about sinus, or sinus. These are blunt tract opening onto the skin or mucous surface. We don't know how it ends, so it may be a fluid may discharge from a sinus or fistula, but the discharge should be examined and noted. If it is blood, if it is blood stain, if it is clear, if it is bile-like, if it's serous, fecal, or purulent. So the type of fluid may give a clue to the possible diagnosis. Lymphangitis, inflammation within lymphatic vessel, appears a red line and often leading to an inflamed region lymph node. And they talk about thrombophlebitis, thrombosed and inflamed vein. We call it thrombophlebitis. Okay, it is more usual in superficial veins and often associated with varicose vein, which are always tender and hard. Okay, so talk about thrombophlebitis. Talk about cellulitis is also a time in surgery, and the cellulitis is a spreading inflammation of tissue, usually superficial, also what we call subcutaneous. Okay, so it's maybe due to bacterial infection, maybe beta hemolytic streptococci or staphylococci. So the part affected is swollen, tense, and tender. Later it becomes red, shiny, and boggy. So it may progress to an abscess, which is the presence of pus in the tissue concerned, sometimes inflammation. So the presence of that redness. Okay. Now, what is inflammation? Inflammation is the redness, the swelling, the heat, the tenderness, and is also associated with the loss of function, especially just a response of tissue towards a damage or injury. I remember we discussed that when we were handling pathology. Okay. Yep. So I want to talk about what we call other term like translucency. Translucency, there are occasions when swelling contains clear fluid like adjacent to the skin. So when a torch is shone through the swelling, it lightens the area, confirming translucency. What about crepitus? Crepitus is also a term used in a variety of conditions, but in each they have to be having a fundamental diagnostic importance. So like bone crepitus is noted as a cause of grunting or movement of bone. It's very painful to the patient and an unmistakable diagnosis of a fracture of a bone. And sometimes joint crepitus is also there. It's just elucidated by one hand on a joint and passively moving the joint with the other hand. Fine, evenly spaced crepitation are always present, and in many subacute and chronic joint conditions, you will get the crepitus. It can be caused irregular crepitation, which signifies osteoarthritis. So the crepitus of what we call tenosynovitis, the tenosynovitis, the crepitus, it always has the tenosynovitis. Some of these terms are very hectic to pronounce. They are found over inflamed tendon. The tenosynovitis. Okay. The cryptus of subcutaneous emphysema is due to gas in the tissue. A peculiar crackling sensation is able to examine the fingers. Talk about ballotment, is when a swelling can be tapped away from the examining finger, often due to fluid adjacent to the swelling. So the term also describes the ability to palpate by manually or renal swelling and to tap the kidney forward from the joint to the examining fingers of the other hand, the abdomen. A swelling may be ballotted from the pelvis by a finger in the vagina to the examining abdomen hand. So talk about fluctuation. Fluctuation is a specific term to elucidate the presence of fluid. Two watching fingers are placed on either side of the swelling. And then you'll have a central displacing finger pressing momentarily. And then an impulse is felt by the watching finger confirming the presence of fluid. So provided the sign is elicited in more than one place, you'll have what we call fluctuation. So those are the terms. And before we go to many other things, yeah, we talk about general surgery because we still have surgical division like general surgery, we still have neurosurgery, orthopedic surgery, plastic surgery, cardiothoracic surgery. Remember that after this you'll do exams. So surgical division like general surgery is the broadest surgical division. It's focus on surgery of the abdomen, the breast, the endocrine organs. So the general surgeons operate on appendix, colon, small intestine, gallbladder, stomach, pancreas, spleen, and liver. But neurosurgeon only involves on operation on the brain and spinal column. Then those procedures include excising or cutting out brain tumors and removing ruptured discs in the spine, an operation known as what we call the laminectomy. What about orthopedic surgery? These one now entails operations on bones, muscles, and joints. You see, orthopedic has something to do with the bones, muscles, and joints. Orthopedic surgery allows for the replacement of hip and knee joints with artificial joints made of special metals and plastic sometimes. Yeah, so fractures in bones are repaired with the implantation of pins, metal plates, and screws. So we call them intermediary screws. We have nails and we have plates, okay? Yeah, that is ORIF. ORIF entails all that. So one day when we'll do some orthopedic units will handle that. So these techniques, orthopedic surgery, yeah, they greatly reduce the time needed for healing and recuperation. Talk about plastic surgery. It encompasses cosmetic procedures to improve appearance and reconstructed. I mean, we normally plastic surgery, we correct appearance. Sometimes you can reconstruct damaged parts of the body, such as skin and underlying muscles. If you had an accident, you appear after healing, you're so ugly, some plastic surgery are necessitated. But cosmetic surgery procedures, they involve enlarging or reducing the size of the breast, rhinoplasty, like cosmetic surgery of the nose, facelift, like cosmetic surgery of the tightened facial tissue, so we loosen them, called that facelift. We have some called blepharoplasty, cosmetic surgery on eyelids. Cardiothoracic surgery, this one now deals with the surgery of the lungs, chest wall, heart, and large blood vessels of the chest. So typical procedures include the removal of the malignant cancer and the correction of the structure of birth defects in the heart, lungs, and chest. So I think on that one now you can do exams, and then that is all.